Our next speaker had an unlikely on-ramp into the medical profession. Get this, for the last month of med school, he worked at the clinic of Big Sky, Montana. That clinic is next to a ski resort, which means for the last month of school, every day he would spend half the month in clinic and half the month skiing. And that in turn means that he earned his very last credit in medical school on a chairlift. Now, he's quick to point out that ever since then, things have been quite different. And from that unlikely beginning in Big Sky, he's gone on to make big contributions to people who are interested in transforming their analog organizations into companies ready for the digital age. Please welcome Aaron Neinstein.
Thank you so much. It's great to be here. So if you're anything like me, to get to this great event in DC, you pulled out your phone and you checked into your flight on an app. When you arrived at the airport, you pulled out your phone again, you used a rideshare app to get to your hotel. And then when you got to the hotel, you pulled out that phone again, and you started binge watching the latest season of Ted Lasso or Succession. And across every phase of our lives as consumers, we are expecting frictionless, on-demand convenience. We want things when we want them, where we want them, how we want them. And we're bringing those same expectations with us into the healthcare arena. So how have we fared over the last decade with technology coming into healthcare? Well, I certainly don't want to go back to paper records, don't get me wrong. I can e-prescribe, I can view lab results and clinic notes from other doctors from around the country. I don't have to decipher handwriting, although I still have no idea what ophthalmologists are writing about, even though it's digital. But if you look at the greatest challenges we face in healthcare in this country, has technology really allowed us to overcome them? We face challenges with cost, with access, with disparities, with poor patient experience, and of course, rising burden and burnout among our doctors and our nurses. Now, lots of investment is going into trying to change this. So we're seeing new models of care built by healthcare systems across the country. We're seeing venture capitalists pour billions of dollars in. We're seeing payers creating new models of care with provider networks, and those networks are getting bigger and bigger. And of course, big tech is even getting involved, most notably with Amazon's purchase of One Medical Group. So we have the opportunity in healthcare to often look at other sectors and other industries to see what they're doing and to take lessons and learn from them. So we could, for example, learn lessons from one of the first early large retailers to sell consumer products through the internet, or one of the first media companies to stream media into people's homes. And you know exactly which two companies I'm talking about, right? So think again. So what was it that separated Amazon from Sears and separated Netflix from Blockbuster? Because while what was visible about what Sears and Blockbuster were putting in front of their customers, what was different was below the surface. So what Netflix and Amazon did is they built technology infrastructures that captured granular data about the end-to-end experience of their customers. They built organizations, teams, cultures around using those data to glean insights and to have those teams iteratively improve their products, their services, their experiences over and over and over again. And that's what they understood. And if you think again about American healthcare over the last decade, we took technology and we put it on top of our existing organizations, and we have not yet done the really hard work of transforming what's below the surface. And that is the challenge and the opportunity of the decade ahead. Now, I grew up in Los Angeles, around the corner from a place called Arts Deli. I used to go there on the weekends for brunch with my grandparents. And like any good LA or New York deli, they have an enormous menu, something for everybody. But now contrast what happens when you take that paper printed analog menu and you ingest it into DoorDash. DoorDash now can tell me with precision. When I go back to my hotel room tonight and I've never ordered from a restaurant in this area in DC, they know based on my ordering history and my preferences what menu items might be most interesting to me based on the restaurants in the area that I've never eaten at before. They can look at tens of thousands of restaurants across the country and hundreds of thousands of menu items and answer important questions like pastrami or corned beef. The answer, corned beef. Now, just like DoorDash is not just a food company, as healthcare companies, we also have to be great, not just at delivering healthcare, but at understanding the data that we collect within our organizations and with the provision of care and using it to iteratively improve. Now, you might be sitting there thinking, oh my gosh, Netflix and Amazon were startups at the time. They got to have a fresh start. I work at an organization that's been around for a long time. I work at UCSF. We've been around more than 100 years. There are great examples of companies that have been able to make the transition into digital organizations. Think Target, Walmart, Delta Airlines, Home Depot. So let's talk for a few minutes about what a virtual care future might look like, and then I want to leave you with some practical tips for how to think differently about your organizations. Now, I'm an endocrinologist. I see lots of patients with type 1 diabetes. And in taking care of people with type 1 diabetes, they frequently wear continuous glucose monitors that measure their glucose every few minutes. They wear insulin pumps that deliver preset regimens of insulin under the skin continuously, 24/7. And in the early part of my career, I would sit in the office with people with type 1 diabetes, and we would download tens of pages of data that looked something like this. And we would try to glean patterns from the data, and I would try to use those patterns to make predictions about what their insulin regimen changes would need to be. Now, fast forward into 2017, the first automated insulin delivery system became available. And we would talk in the back office, do people need endocrinologists anymore? Now that we have, these algorithms that are continuously adjusting people's insulin regimens for them, why do you need an endocrinologist? Well, I've been actually completely surprised and delighted by what has happened. It turns out that instead of spending my time trying to be a poor substitute for a computer and looking through these pages and pages of data, I actually talk to my patients. And we get to talk about what are their challenges and their needs in life with type 1 diabetes. And so I think Eric Topol really got it right. He said this in his book, Deep Medicine. We don't need AI to cure cancer. We need AI to help us restore the human connection in medicine, that human connection between the doctor and the patient. Now, as precious as that is, it's also very expensive. And so having a patient, a doctor, a building in the same place in the same time is an unsustainable way to try to deliver care to everyone who needs it across this country. And telemedicine has relieved some of those geographic boundaries and barriers, right? So no longer do you need to be tethered to a place. But at the end of the day, it's still a synchronous unit of time and interaction. And so we have to be shifting more care using technology into new care modalities that leverage artificial intelligence and leverage asynchronous modalities of care. So one example of that, at UCSF, we have one of the largest lung transplant programs in the country, about 500 people who are living all over the Western United States having had a lung transplant. And we used to bring people to San Francisco for pulmonary function tests regularly. We would fly pulmonology doctors to Boise, to Portland, to Reno, to have appointments with patients at satellite locations. What we started doing during the pandemic is we sent people a home spirometer, and they enrolled in a chat program, and so they text with us about their symptoms every week, and the results have been fantastic. We have had great patient satisfaction. People have reduced by about 40% the frequency with which they travel to San Francisco for their care. And our quality results are great. No change in emergency room visits or hospitalizations. In fact, the rates are even a little bit better than they were before. So where we might be headed in the future, of course, is ingesting lots of data like the continuous glucose monitoring, like we see with the home spirometers. We can understand, just like DoorDash, right? What is the personalized, precise treatment that is needed for each person? And then as we deliver that treatment plan, how do we tailor it to individual needs? And how do we adapt education and content to people's individualized needs along the way? Okay, so how do you get there? How do you make yourself a digital organization? Well, the first thing is to look in the mirror and remind yourself that this is not what your organization looks like. We no longer have a calm waters and a predictable destination and a predictable path to get there, and just have to stay pointed at those clear, calm waters. It looks more like this. So we have to create organizations that are capable of sensing the environment, of understanding that that environment is dynamic, is complex, and of putting agility into our organizations to change on the fly. So one way we've tried to do this at UCSF, and learning the lessons from Sears versus Amazon, is in the past we might have said, let's focus on getting self-scheduling to our patients. And that was looking at what was above the surface, what was visible about self-scheduling and delivering that to our patients. What we've done now is we've said, you know what? We're a complex care organization. People come to us in a time of need when they've been diagnosed with cancer or their kid has been diagnosed with type 1 diabetes, and they're looking for care. And that experience of someone who needs a tertiary quaternary medical center for that acute moment in their life, that's something that's going to be an important part of our experience forever. So it's not just a one-time project where we turn on self-scheduling and go on to the next thing. We built a team around the new patient experience, and they wake up every morning and they look at the data. And so we've put granular data collection into that entire end-to-end experience that our patients are having. And this team wakes up every morning and they try to understand, where are our patients facing friction in that process? What is their experience? How can I iterate that experience to make it better tomorrow than it was yesterday? Now, one thing you realize as you start looking at the end-to-end experience, if you're a healthcare system, is guess what? We don't control the whole thing. When patients come to your portal or your website, they have already been looking on Google. Most healthcare searches start somewhere else. And so as we think about digital experiences and becoming digital organizations, those integrations and weaving together the ecosystem and looking through the lens of the patients we serve become critically important. Another important lesson that becomes apparent, I don't know if anyone's had a similar experience to this. I called in a takeout order to a restaurant a couple of months ago. When I got there, I waited in line for half an hour. Turns out there was one cashier at one register, and there was a line of people who were ordering in the restaurant, people like me who had called in orders, and then just hordes of Uber Eats and DoorDash drivers all crowded around this one register. And the restaurant had not redesigned itself for a world that exists in digital and analog interactions. Our physical footprints are built for analog world. Now, contrast this. This was actually just a few days ago. I went to pick up some pizza, and the restaurant had completely redesigned a drive-through for curbside pickup. Or contrast that to last time you put an order in at Target, right? What did you do? You took out your phone, you placed the order on the app, you drove your car up to the Target parking lot, you open your trunk, they put the bag in, you drive away. And so we have to rethink experiences. Digital is not a separate thing. Digital is something that is woven into the fabric of the experiences that we deliver to those we serve. One other thing about digital is there are many capabilities that are important to becoming a digital organization. Understanding at a granular level who the different patients or customers are that you serve. Using design and human-centered design principles to do user research with an inclusive, broad group of people. Collecting data about who's using your services and how they're using your services, and understanding at a personal level the differences in how they're engaging. Now, think about the challenges we face with health equity and disparities. And those very same principles that can make you great as a digital organization can also be important in advancing affordability and access and individual delivery of care. Because equality, right, giving people the same experience is not the same as equity, which is understanding and meeting the individual personalized needs of those we serve. So if I leave you with one thing today, it's to remember that if you're a healthcare system and you think that you've solved the patient experience by having a patient portal or having a consumer-facing website, that's just what's visible above the surface. And digital is not that. Becoming a digital organization is about everything below the surface. And so it's about having the expertise in your organization in design, in data science, in product management. It's about having standard workflows because you have to be able to measure and collect data from standard operational workflows. It's all about the data, how you collect it, how you use it, creating data literacy within your organization. It's about creating cultures like Netflix and Amazon did around continuous improvement and about using those data to iterate over and over again. And it's about thinking not like the restaurant with the one cashier, but like the restaurant who had or Target who have you pull up and do curbside. It's about thinking about the entire ecosystem of care. Healthcare does not exist just within the four walls of our hospital or our clinic or our health system, but you have to view it through the lens of the person you're serving and think about their experience and design for that entire ecosystem that they're a part of. Thank you so much.